So in the second part of the presentation, we will discuss about chikungunya, like clinical features, diagnosis, and treatment. The common symptoms of chikungunya, as mentioned by, I think we discussed earlier, is fever, joint pain, headache, muscle pain, joint swelling, and rash. These are the common symptoms of chikungunya. As I think one of you raised, I think Chandan raised, these symptoms also can occur in dengue. Okay, you can see these are all the like a joint in the acute stage. You can see the joint swelling, edema, swelling. You can see in the first picture, joint swellings, and in the second picture you can see the rash, red color, like measles rash. So this is the like if you want to distinguish the by symptoms, chikungunya, dengue, and Zika, you can see which are the symptoms predominant in which virus. Can someone see and look at what are the difference between, like, in terms of symptoms? In which disease, which symptoms are more, which symptoms are less? Can someone see this slide and tell?
Sir, fever is more in case of chikungunya and dengue, sir.
Very
As
good.
compared to Zika virus.
Yeah.
And arthral
myalgia means body pain. Myalgia means body pain.
Body pain is much more in case of chikungunya, sir, as compared to the dengue and Zika. But still, a little bit there is
myalgia, body pain. I think the 3+ is in dengue. So
yes, sir. 3+ in dengue, sir. Orbital pain is much more in dengue, sir. As for the
dengue, arthralgia means joint pain. Joint pain. Which joint pain? Where you see the 3+?
That is highest in chikungunya.
Chikungunya. Yeah, in chikungunya, joint pain is very severe compared to dengue and Zika. Okay. Retroorbital pain, that is, retroorbital pain means the pain behind the eyes. Behind the eyes, there will be pain.
Sir,
it is in dengue, sir.
Dengue. Yeah, it is more in dengue. Skin rash
is much more in chikungunya as well as Zika virus.
Zika virus, very good.
Arthritis, that means the edema is much more in case of chikungunya. But it is not found in dengue. But
conjunctivitis. Conjunctivitis means red eyes. Eyes will be red. It is the more common in Zika.
Zika virus. What is the non-purulent conjunctivitis?
Non-purulent means there won't be pus coming, just like viral infection. No? Purulent or non-purulent means pus will not come from the eyes. The discharge will not be there. Just redness of eyes. So that will be there in Zika. Arthritis and edema more common in chikungunya.
Sir, plus with minus, it is what it is indicated. When it may be bleeding or may not be.
May be there, may not be there. Like thrombocytopenia. What is thrombocytopenia? Low platelet count. Platelet will be low in which condition? Dengue. Dengue will be, platelet count will be very low. Okay.
Sure.
But in Zika, it may be there or may not be there. But chikungunya, it will be mild. But platelet count will be very low in dengue.
Sure.
Very similarly, like BP will be low in dengue. That's why the hypotension, shock, dengue shock syndrome. And lymphocyte also will be low in chikungunya and dengue. So is it clear now from the symptoms? Like what is the difference between dengue? I think by symptoms, it is very clear from the slide. From the these three are transmitted by the same mosquito, chikungunya, dengue, Zika. And the symptoms are also more or less similar, but some symptoms are more common in some disease. Some symptoms are very less in some other. So with this chart, I think we will be able to guess which outbreak based on the symptoms.
Hello,
we can definitely diagnose only by lab test. Yeah, please go ahead.
Sir, what is the difference between lymphadenopathy and lymphopenia?
Lymphadenopathy means the lymph node swelling will be there. Lymph node swelling will be there, no, in the neck or in the axillary region. Okay, the lymph node is swelling. But lymphopenia means in the blood, when you take the blood sample and test for it, the lymphocyte will be less. Sorry, Chandra, your voice not audible.
No, sir. Everything is clear, sir, for me, sir.
I think somebody else was asking some question.
What about thrombocytopenia?
Thrombocytopenia means low platelet count. Platelet count will be low. We all know that in dengue platelet will be less, no?
Yes, yes, sir.
Yeah, that is called thrombocytopenia. Any questions, or shall I move to the other slide, because this is important, because we have to, based on in the field with the symptom, we should be able to differentiate somehow the dengue chikungunya.
Yes, sir. We will move, sir. Next slide.
Yeah.
Yes, sir.
But chikungunya, one of the dengue is only the acute disease. There is no chronic complication. But when it comes to chikungunya, it can occur.
Hello.
Yeah, Majiji.
Actually, one patient at the time of two diseases infected, dengue and Zika.
Yeah, definitely it can occur. The co-infections are very well documented. At the same time, the person can have dengue and chikungunya. At the same time, the person can have dengue and Zika. The co-infections are very common because the endemic area, virus, the mosquito is very common. It is a common for all the three. So one person can have two infections. Only based on the laboratory test we can confirm. Co-infections are reported.
That type of laboratory we have at the field level, sir, actually.
Yeah, because ELISA only will be doing, no? Like ELISA for chikungunya, ELISA for dengue.
Sir, if such, sir, then which disease should be counted first, sir, by the what we call the physicians? If such two or three more virus are attacking at the same time, sir.
Yeah. I think the patient has to be admitted and carefully managed, because both he will have the joint pain from chikungunya. Also, he can go in for shock if he has dengue. So
Yes,
in that case, if the patient is testing positive for both, then it has to be handled carefully. Chronic chikungunya patients, like after 9 months, they can also have like joint swelling. This is called rheumatoid arthritis. Yeah, please go ahead.
Hello.
Yeah, please go ahead, Ji.
Sir, actually, frankly, said to me, sir, this type of laboratory services not at our district, sir.
Yeah, district level it may not be there. At a medical college, I think they can test for chikungunya.
Yes, sir. At the time, the virus is spread. Actually, frequently virus is spread in the community, and the broad area already spread the community. That is the one type of epidemic situation at the time of the Zika or ADC or dengue.
Yeah.
Very this type of very bad situation for us, sir.
Very good, sir. I think now the government of India is aiming at, because after this COVID, they realized the importance of lab. Government of India is planning to strengthen the district level labs. They are going to, in the upcoming years, they are going to invest a lot of money in the district level public health laboratory. So I think when the district public health labs are strengthened, these testing can be done at the district level.
Sir, actually, that is very nice. If that is possible, we are very happy, sir.
Yeah.
Because we are the field staff.
Sure.
Okay, sir. Thank you.
I think I heard a message like, whether my voice is audible, loud and clear? I think.
Yes, sir. Yes, sir. Yes, sir.
Okay, thank you. Thank you. I think with the district public health labs, we will be able to diagnose better in future. And who can get severe disease of chikungunya? Like chikungunya generally, chikungunya and dengue. Another important difference is which is more fatal. That means death is common in chikungunya or dengue?
Dengue, sir.
Dengue, very good. Death is very rare in chikungunya. Chikungunya the problem with the chikungunya is it can lead to disability. It can lead to joint pain and joint like rheumatoid arthritis. All these chronic joint problems can come because of chikungunya. So that is why disability is more in chikungunya. Sometimes death is fatality is compared to chikungunya, it is more in dengue. And Zika, the problem is it is generally a mild infection, but if it affects a pregnant mother, then the child can get microcephaly, like the small head. So the risk factors for severe disease like a newborn child or old age people or people with other disease conditions like hypertension, diabetes or cardiovascular disease. If they have any of this disease and if they get chikungunya, then it will be like severe. Diagnosis of chikungunya we can test by IgM ELISA, or we can, if you want to like test the virus, then you can do RT-PCR sample. RT-PCR sample will be positive only in the first week of illness. Within 7 days, you have to collect the blood sample for testing for RT-PCR. Like in this picture, you can see that when the mosquito bites, the person gets a symptom onset that is called D1, day 1 of symptom onset. If you are doing RT-PCR, you should do within 7 days. But if you are doing serology after 5 days, IgM will be positive only after 5 days. It is very similar to dengue. Dengue also IgM will be positive after 5 days. Before 5 days, if you want to test, you have to test for NS1 in dengue. Here RT-PCR within 7 days. After 5 days, IgM will be positive. IgG will be positive after 10 days. It will be positive for lifelong IgG. Treatment is, I think already we discussed, there are no specific antiviral treatment. Like you have to take plenty of the people, because it affects joint, they have to take rest, drink lot of fluids, and then they have to take paracetamol for pain relief, and then reducing the fever, taking paracetamol for pain relief and reducing fever. And then avoid, they have to avoid drugs like aspirin or NSAID till the dengue diagnosis is ruled out. Only after ruling out dengue, they can give aspirin or Brufen or Oviran for pain relief. Management, I think already we discussed in dengue, the management is very similar like vector control. We can control chikungunya only by vector control, that is controlling the Aedes mosquito like in the adult stage or larval stage, anti-larval measures, fogging to control adult mosquitoes, personal protection like full cloths, full sleeve cloths, or using mosquito repellents, or we can use like mosquito, we can screen the houses using mosquito nets they can use, and biological like anti-larvicides we can use like using fish, all those things like gambusia, we can control the mosquito larvas. And then chemical control is like we can use, we can apply, what is the chemical we apply in water for control the Aedes larva? Chemifos, no? Yeah, it's called abate, I think. Can apply that. So vector control, we know that it's very common to dengue and chikungunya. Dengue, we have discussed that we already have a vaccine, dengue vaccine, yeah? And there are many other like Takeda's TDV vaccine also completed the phase 3 trial. So soon we may have another vaccine for dengue. For chikungunya, the vaccines are there. There are two promising candidates, one developed by Bharat Biotech and the other by Pasteur Institute in France. So the two institutes, two big pharma industries are like developing the chikungunya vaccine. They are all in phase 2 or phase 3 trials. So maybe in 5 years or 10 years, we will be having at least within a 5 year, maybe we will have a chikungunya vaccine. Thank you.